Hello, my name is Dr. Danielle Head, and you can call me Miss Danielle. And your name is?
Felicia Mitchell.
Nice to meet you.
Nice to meet you too.
In the beginning, I gave you a questionnaire about your feelings. Were you able to complete it?
Yes.
Good. I have a set of ethical guidelines that I would like to go over with you that I must follow. Your best interest is my priority. To better explain, I'm not looking for what is best for me, but what is best for you. As part of the ethical framework, there's the notion that everything is spoken in confidence and confidentiality. Do you understand me so far?
Yes.
Good. So whatever you say stays here between you and I. There are two possible exceptions to that. And the first one is if I believe that you or anyone is at risk of serious harm, I will have to disclose that to a third party. Do you understand me so far?
I am wondering, who is a third party?
Okay. To better explain, a third party would be the local police department or another agency that helps in that profession.
Okay.
Are you feeling okay and understanding what I'm saying?
Yes, ma'am. I am not feeling suicidal or don't want to hurt anyone else either.
Good. I have a legal duty of where other children or other adults are being harmed. It is best to tell me, and I will forward this information to the proper authorities. Do you understand me?
Yes, I feel good knowing I have someone like you that I can talk with and cares about my well-being and others too.
Good. I would like to go over another ethical term that I must follow, which is supervision. Literally, it means I talk through my work with another experienced therapist, but it's for the benefit of the people I work with in a way to get a fresh perspective. This is all covered by the same confidentiality agreement. We will not disclose any information about you to anyone else if it doesn't exceed the exception that we discussed earlier. During this therapy, I would like you and I to build an alliance. Would you agree to that?
Yes, ma'am. Most definitely.
Good. The benefit of building an alliance is therapeutic, and it holds additional agreement on the goals and tasks of the therapy process. For this session, we have just about half an hour, and I want you to feel free to tell me what is bothering you. I see some of your emotional and other problematic behaviors started after your dad and mom divorced. Could you tell me more about that in detail?
I am 2 years old and I am still struggling with sadness and anger from when I was younger. I am also trying to stop drinking alcohol and smoking pot as well.
Could you tell me why you feel that way?
When I started hanging with some friends and that my parents didn't like, my parents started to argue more, and I would rebel by drinking and smoking pot with my friends. I started to notice after a while that I was drinking and doing pot by myself.
How long was this going on for?
It was almost 3 years, and then my parents announced they were getting a divorce.
I see.
I feel like it's my fault that they divorced.
It's totally normal to feel that way. Just know it's not your fault with your parents divorcing.
Lately, I have been drinking and smoking pot to make me feel better, but I still feel sad once I come back to reality.
Once you come back to reality, what do you think or feel?
I feel sad and then angry sometimes. I want to cry, but I can't.
How long will you feel this way?
It seems like forever, but it usually lasts for like 30 minutes or more.
The good news is that you are not the first person to go through this, and there is help for you for what you're going through. Just know you do not have to go through this alone, and I want to commend you for getting help and trusting me with your feelings.
Yes, ma'am, and thank you.
I have in mind 2 therapies that I would like to tell you. One is called Therapist Self, and the other is called Ecosystemic Structural Family Therapy. The use of the therapist self in therapy, which may include self-disclosure, creates a self-relationship in which clients can practice communicating congruently without negative consequences and learn to tap into more authentic modes of expression. And the ecosystemic structural family therapy is used to treat a wide range of child, adolescent, and adult clinical or addiction problems across all levels of severity and diverse treatment settings. I believe using the ecosystemic structural family therapy is more beneficial for your recovery at this point in time. Using this therapy will help me explore the ways that unresolved trauma contributes to your family difficulty. difficulties with emotion regulation in everyone as well as in the family. Does this sound good to you?
Yes.
Good. Also, there is a place called Meridian that helps with substance use. If you are interested, I can refer you. Also, I would like to go over one more therapeutic thing, which is to journal your feelings. Journaling can help your brain not to worry as much. On a neurological level, being worried is like you're constantly multitasking. You're trying to focus on one thing, but a portion of your cognitive efforts are always wasted on suppressing those worries, making it hard to stay fully present. Would this be something that you would be interested in doing?
Yes. I feel hopeful and excited about the future of my health. I feel like I am on a good path in life, finally.
Good. I would like for you to journal your feelings that seem to make you unhappy or angry. I want you to journal what is going on at the present time and note how long it lasts. Is that something that you can keep up with?
Yes, I feel hopeful and excited about the future of my health. I feel like I am on a good path in life, finally.
Good, good. I'm happy to hear that. Together we can work through this, but it is a process. So always remember the first step is to show up and we'll go from there. Well, Felicia, it was lovely meeting you, and it sounds like we made a great start for you on your new path to recovery. Well, this concludes our visit, and I look forward to speaking with you at our next visit. Do you have any questions for me?
No, ma'am. I want to say thank you for listening, and I can't wait till our next visit.
You are quite welcome. And know that if you have any questions or concerns, you can call me at any time. Have a wonderful day.